Hi, I'm Frank Spear. I want to welcome you to this blog. You know, we've been going through an entire series now of how to fabricate temporaries and carve them and finish them and cement them. What we haven't talked about is how to remove them. And bonded temporaries, there's not a whole lot of options. Typically when you bond a veneer temporary or bond an onlay temporary, you have to grind through it where you bonded it before you can actually get it off. And sometimes you have to cut them into pieces to do that. But for traditional temporaries, what I wanted to do is share with you how I take them off. And probably the tool I've used the most for literally almost 30 years is a pair of carbide tipped hemostats. And this happens to be a Miltex branded pair, but there's other ones on the market as well. The trouble with traditional hemostats is that they don't grip acrylic well and they slip and can pinch the patient. And there are certainly hemostats out there that are very fancy with screws that can tighten them and hold them, etc. But if you look closely at this picture, you'll see the nice carbide tip that's inserted into that hemostat, and it'll grab that temporary and really hold on to the acrylic well. Now the challenge when you're removing a temporary is simple, and that is the tendency is to think that you just want to rock it back and forth, but that's not taking the temporary off. That's just binding it against the tooth, the prep. And you can risk breaking the prep, you can risk breaking buildups off. Whenever we take a temporary off, we want to always try and pull along the path of insertion, not rock it back and forth buccolingually. We want to pull along the path of insertion. Now, in a series quite a while back, I showed you how to use a fulcrum to remove a permanent crown that had been temporarily cemented, where if you were trying to get a lower first molar temporary out, you actually would put a toothbrush up on the premolar sticking out to the buccal, and then grab the first molar with the tip of your hemostat and push down in the front, and it pulls the crown up in the back. And that's a super good technique to use with these hemostats, is just grab the posterior crown, put your toothbrush across the front, pull down in the front, and it'll pop right up. Now, in this case, I'm going to take off a whole arch of temporaries that are cemented in 3 pieces with caulk phenol. It's harder to use the fulcrum technique when they're all splinted because you're actually fulcruming against something you're trying to take off. So I'll just walk you through a video. Here's the case. It's a full upper arch and full lower arch that's all prepped and in temps with caulk phenol. But you'll see a video of how I actually go through the process of taking those temporaries off. So first I'll grip the first molar, and what we'll be trying to do is actually grab the first molar and very little buccolingual movement, but I'm pulling down. And as soon as it starts to move, it comes off. I've air abraded the inside of these temporaries before I cemented them, so all the caulk phenol sticks to the inside of the temporary, and you'll notice the preps are super clean. Anterior, easy. You grab it, very little buccolingual movement. It's pulling and just a little bit of buccolingual movement. Watch up at the margin. As soon as you see the margin move, you know it's not cemented. Then just keep going to the adjacent tooth and back to the adjacent tooth. And any place you see it binding, make sure that's where you go and pull. And in a matter of less than a minute, all those temporaries are off and the preps are basically clean. All done with those Miltex carbide tipped hemostats. Now, if you have really long preps, sometimes it's harder to get those off. And if I have really long preps, I am more likely to actually cut a notch up the facial of the temporaries and separate them. But that doesn't happen very often unless you have a patient that has some significant periodontal disease. This is what those teeth look like after that temporary came off and that one piece of cement was flecked away. Now you can either air braid these teeth, or you can use pumice and water in a rubber cup to clean them up, and you're good to go as far as your cementation. And this is what the final restorations then look like that were bonded on those preps afterwards. And in fact, these restorations are actually bonded using a dual Curadentin adhesive, Panavia ED primer and Panavia F as the cement. So I hope that helps with some ideas about removal of temporaries. Pretty much the only tools I usually use. I have a lot of tools I used to use in the past, but the Miltex carbide tipped hemostats is kind of my go-to tool for taking temporaries off. If they don't come, which is very rare, then I just go ahead and cut a little notch up the facial and break them. So enjoyed sharing that with you, and I'll look forward to seeing you soon.